sucked back in. And I think that's because my auntie, I was asking her to swallow at the same time at this point, and I asked her to stop. I just asked her to blow into the balloon, hold her breath, move the balloon away, and then just open her mouth without swallowing, because I think the swallowing was the opposite effect. It was sucking some of this fluid back in. So we wanted to keep this fluid in the outer ear. And again, just be careful that I'm not going to push this grommet further in, and it obviously don't want to touch that canal wall. It's very sensitive. Where was I? I was talking about, what was I talking about? Here's me losing track. It will come back to me, I'm pretty sure. But whilst I'm thinking about it, I'm just going to go back to the procedure. So you can see it was quite a lengthy procedure combined, and in between these clips, obviously I was out of the ear for several minutes at a time, so there's a lot of edited bits out where I wasn't in the ear, so the whole total duration was a lot longer. Yes, I was saying I didn't want my auntie to after using the Otovent nasal balloon, I wanted her to keep the fluid out. I've just had to rewind to see what I was talking about before I lost track myself. I was talking about motion parallax and how you can obtain depth perception with an endoscope by not having stereoscopic or binocular vision, but just monocular vision. If you're on the highway or the motorway and you're driving, and if you look directly out the window at the cars going past you, or the cars in the opposite lane, in the opposite direction, those cars are whizzing past. But if you then look at in the distance at a building or a landmark, a tree, because that's further away, that is not whizzing past as quickly. So motion parallax is when you're judging the distance by looking at the relative speed at objects near to you and further away, and by comparing the two, your brain can tell you, it gives you a sense of depth perception. Also, with an endoscope, you can use shadows, ear anatomy, and it's all simply just go closer with the endoscope. The closer you get, the better depth perception you get. So you can see with that, we go really close up to the grommet. So I'm nearly done now in the last couple of minutes, and I think at this stage I was just asking my auntie just to blow her nose a lot more with the Otovent. And again, you can see there's more fluid leaking out, and I just want to get as much out as possible. We've written to the GP, asked for the topical ciprofloxacin, and we're using the eye drop version. They are used as off-label by ENT, as mentioned previously, for infections of the middle ear where there's a hole. They're safe to do so. You can see that bend also helps me to kind of almost rest against the bottom of the ear canal. I'm using it, I'm just hovering over the top, and because I'm using the underneath, on the side of the suction probe, I'm not digging into it, so it's almost just kissing the surface of the floor of the ear canal, which won't be as uncomfortable, but there's no other way of getting access. I tried bending the tip of the sucker the opposite direction, so I'm going from up to down. But what I was noticing was with that kink, with that bend at the top of the fine end, it was grazing against the roof of the ear canal. And it was also limiting my movement. So I was trying to go further in, but that suction probe was almost catching the top part of the ear canal, and it was stopping it. And then I was having to put more force in to overcome that friction. And sometimes if you put too much force, you suddenly break through the friction, and that sucker, you lose control of it, and it goes far too into the ear.